Okay, so here we go. So demographic trends. So first of all, birth rate. Birth rate is the number of live births per thousand of the population per year. Total fertility rate, on the other hand, is number of births an average one will have between the ages of 15 and 44. Now they're both influenced by the same thing. So the causes of change, both of these go down, is that there's been change in gender roles of women. Infant mortality rate has decreased. There's a cost of childcare and child raising has gone up. There's been a change in attitudes towards childless and having less children or not having children at all. And there's been an increase in effective contraception. Now, the impact of this is going to lead to a rise in dependency ratio, which I'll come to in a little bit. There's going to be a strain in public services, which again, so healthcare services, childcare services will be put under pressure because there'll be less demand for the service, and that will lead to further changes in gender roles. In terms of family, the families become smaller, more child-centered. There'll be more financial and emotional investment in children. Women's role will be changing as women enter the workplace or return to the workplace, and there's going to be greater diversity because there'll be growth in single-parent families and childless couples because of the choice and the option available. And in terms of the impact on society wider level, there is this issue of an aging population. You can see on the little graph on the screen that as society progresses, as we have less births, that leads to partly an aging population. This will also have an impact on dependency ratio. As there are more older people, there'll be less working populations that will raise the dependency ratio. So this could lead to a change in services. There'll be less need for youth and education related services. Now, when it comes to death rate is fairly similar to birth rate, and it's the measurement of number of deaths per thousand of the population per year. Infant mortality rate, on the other hand, is number of babies done before their first birthday per thousand live births per year, and life expectancy is how long we can live. Now, death rate and infant mortality rate have dropped. Life expectancy has improved, and life expectancy and death rate are measured. They're sort of measuring the sort of same effects and cause and consequences, but it's whether, how many people die and how long we live. But it's a very similar cause and effect system. Now, the causes of death rate, infant mortality rate dropping, life expectancy rising, would be stuff like the Beveridge report, bringing in the NHS and universal healthcare. Medical advances, improvements in hygiene and nutrition, improved maternity care, and generally as a population we are more aware of our health needs, and we make more of a conscious effort to be healthy. So that kind of also has an impact on lifestyle choices. Now, the effect generally is dependency ratio will go up. So as I say, there'll be more older or dependent population in relation to working population, but we might also see an increase in opportunities for older people in society generally. In terms of family life, there'll be changes to families, so there'll be more diversity. So we're going to see increase in beanpole families. There'll be an increase in strain in terms of families, so families, communities providing care for the elderly. Role of grandparents in the family will improve and increase, and also Charles highlights that the grandparents free up mums to go back to work. This will lead to more dual learner, neo-conventional families. Again, the impact on society, birth rate decline and death rate decline, they contribute together to an aging population. Strain on public services, again, is more older people. Older people take up 40% of the NHS budget currently. Demand for care homes, social care services will be more significant. We also have the grey vote, the grey pound, and obviously the economic spending patterns, the voting patterns, the consumption patterns of older generations will have a big impact in society. We also might see a change politically in terms of discrimination legislation becoming more vigilant as we have an older population. And then lastly, we have the migrations. Now, the causes of this: international trade, new technology, transport, communication, political change, and also push and pull factors. The effect, it adds to our diversity. That's a really positive thing. We have more social diversity. Population will increase. This could put a temporary strain on services, particularly more children, but longer term it will help lower the average age of the population and reduce dependency ratio. When it comes to family life, this will lead to more LATs. We can talk about LITWAC and the modified extended family. We can talk about dual heritage childhoods, and obviously this does have an impact on DDOL, as discussed in previous videos. And then last but not least, the impact on society. So it adds to our diversity and multiculturalism. That's a really positive contribution. As a result of leaving the EU and the Brexit sort of process, immigration into the UK has dropped emigration of British people leaving for European countries and Europeans leaving to return to Europe. This is going to make society harder to survive. And obviously that's going to have a big impact, but we have to wait and see what happens there. Okay, there we go. So that's very, very, very brief overview of demography.